Hello, everyone. We're going to go ahead and get started. Thank you so much for joining us for today's conversation. I am Sarita Edwards. I am the CEO and president here at the EWE Foundation. We are a healthcare advocacy organization. We facilitate resources for families living with rare diseases, medical complexities, special health needs, and disabilities. Our disease affiliation is Edwards syndrome, which is commonly known as trisomy 18. We also provide economic assistance to families living with trisomy 18 that may be experiencing financial hardship. So just a few housekeeping announcements. This conversation is being recorded. You can access the video replay on our YouTube channel. You can also access an audio replay on our Being Rare podcast. You can find links to both of those platforms on our website. This event has also been approved for 1 CEU. For those interested who are joining us live, you will receive that CEU certificate of completion via email. If you're watching the replay or listening to the recording and you're interested in that CEU, please just reach out to our LEAP program for the course evaluation. So today's conversation is not a fun topic, but it's a necessary topic of conversation. Today, we're talking about child abuse and neglect prevention. In the United States, at least 1 in 7 children experience child abuse or neglect annually. Children with disabilities are at least 3 times more likely to be seriously injured or harmed by maltreatment, and they are more at risk of being abused or neglected by their peers without disabilities. As an organization, we are committed to providing education, resources, and support to help prevent all types of child abuse and neglect and improve the overall well-being for children with and without disabilities and their families. Joining us for today's conversation is Sallye Longshore, Director at Alabama Department of Child Abuse and Neglect Prevention, the Children's Trust Fund, and Stephanie Wright, the Director of Family Services at UCP Huntsville and the Tennessee Valley. Thank you both to Sallye and Stephanie for being with us today. So we're going to start the conversation. We're going to start with Sallye. Once Sallye finishes her presentation, we're going to hear from Stephanie, and then we'll come back together for just an overall open discussion. So I'm going to turn it over to Sallye now.
Thank you, Sarita. And she didn't tell everybody on this wonderful webinar that she is a stellar member of our Parent Advisory Council here in Alabama, just newly created, just kind of got kicked off last July. So we really welcome Sarita's presence and her input on that PAC, as we call it. I am pleased to go over, I'm not taking the whole 15 minutes, I hope, but it's going to be an overview of our agency's work and why we're committed to the prevention of child maltreatment. So Sarita is going to start with a slideshow and get us started. And we can already go to the next one. That's just mainly our logo page. So I think there are a lot of key things here. One, we've been in business 39 years. In 2007, we became the state chapter for Prevent Child Abuse America, which was a huge undertaking. And we get so many resources from PCAA, as we call them. The mission statement was not created by me or by our current board of directors, but was created again about 39 years ago. And the key part of that to me is the last sentence, because they were wise enough 39 years ago to know that our advocacy work for children is so important, but that strengthening of families. People ask me all the time, well, how do you prevent child abuse and neglect, Sallye? And I say, well, it's strengthening families. It's that work. And you're going to hear a little bit more about that as we move forward. Next one. Sarita had asked me to include just an overarching definition of child abuse and neglect. And I hate to read a slide, but every bit of this is real important because it's really in the law. Harm or threatened harm, and threatened harm is a key to that. So it's not just that you commit, a child can be abused by having that emotional threats and things that are going on in the home that are bad. So it doesn't have to be a physical blow necessarily. It can be a threatened harm. And that harm can be to a child's health or welfare, which can occur through non-accidental physical or mental injury, sexual abuse or attempted sexual abuse, sexual exploitation or attempted sexual exploitation. So you can see the legalese that's kind of woven through that definition. But the key to me is it's not just harm, it can be threatened harm to all aspects of a child's health and welfare. And obviously then non-accidental, in other words, it's intentional. Next one. Next slide. So how do we go about preventing child maltreatment? We do it through our community-based work, through our grants, as we call them, grantees. So currently there are 175 programs throughout the state of Alabama, and that's how they're kind of woven out in terms of, we say, funding buckets. We do not dictate to communities what they write to us for. We don't say, well, you've got to have a mentoring program over there in Opelika, or Mobile, you need another respite program. So they come together as communities, and we're real proud of that. A lot of them work through their Children's Policy Council, but whatever means they work through, they're not duplicating the different efforts. But you can see the majority of the programs we fund are parent education and support, because we know that is just key to getting those supports that you're about to hear in families, so that they can become more aware and have the like I said, those wraparound services that prevent child maltreatment. You're going to hear a lot about respite today, because those 7 respite care programs are real important. Stephanie's going to talk about one that we fund in the Huntsville area that's been duplicated. That model's been duplicated across the state. And as Sarita said at the beginning, we know that children with special needs are much more vulnerable to abuse and neglect. Next slide. We're going to talk a little bit now about how we go about doing that strengthening families work. And it's really taking those 5 protective factors and putting them to life in your work. They're truly, to me, the key to prevention of child maltreatment. Next slide. And again, the strengthening families, it's not a curriculum per se. Strengthening families is an umbrella, kind of a way to work with families by looking at what's going right. You're looking at those families through a different lens. As the slide says, we're focusing on what's strong in the families, not what's wrong. So when you refocus, you recalibrate how you're working with families, it builds that relationship, that sense of trust. I know a lot of people say, what is one of your best ways of prevention? Well, our home visiting programs are great, because if a parent lets you into their home, that automatically states that they are secure, they feel a sense of trust in letting someone come in their home and work with them. Next slide. And here we go. I ought to have a drum roll, Sarita. These are our 5 protective factors. And again, it's not that one is more important than the other, but it's working with all of these, kind of weaving them into the life of a family. So you can see one's not important than the other. Social emotional competence of children is very important. We want all kids to understand that, you know, it's okay to speak up if something is not feeling right. And if they've got that social emotional competence, it gives them the strength to do that. We also know that families who can meet their own basic needs, all those wonderful things, those economic supports, housing, they're much more better able to ensure the safety and well-being of their children, because again, they have those wraparound support services. Resilience is so important, and we know it's something that we can teach, that we can build. And parents, we kind of have that, it's kind of like that bounce back attitude. So parents who have resilience and they can cope with everyday stresses of life, gives them that again, that resilience and the ability to bounce back and not just be overwhelmed. knowledge of parenting and child development is so important. And I would say, especially, Sarita, to folks that may be tuning in here that may be a parent of a special needs child, knowing those ages and stages, knowing what is typical, even if it's slower in a child that has special needs, they still progress through different ages and stages. So I can't emphasize that enough. And maybe it's because by nature I'm a child development specialist, and I like to tell everybody whatever degrees I have that say I'm an expert at parenting. Let me tell you, when my first child was born 2 months early, you could throw all that knowledge kind of went out the window for a little bit, because I had to just pull back and know that he was facing some real serious health and challenges that maybe the books didn't teach me. So that's still very important to know those ages and stages. And then we can't emphasize enough social connections, because again, I like to start out our promotional video. It starts with me saying, it's certainly not a sign of weakness to ask for help. It's a sign of strength. So having parents that are emotionally supportive with that network, it can be their faith-based community, it can be their family. If their family's not close by, just friends, but having those people that can be emotionally supportive and stand with them is very important. So when you mix all 5 of these protective factors that make up strengthening families, you can see that family, again, that family is going to have the resources, the things necessary to be able to be a better parent. And a better parent creates healthier and thriving children. Next slide. Next slide. Well, let's go right into how we're using that framework in Alabama. I'm really, really proud, because I think we're one of only 2 states in the country that require all their participants, all the people that get grants from the Children's Trust Fund. We asked that somebody in that grantee complete all 7 online courses, and we even inspect it. We go out and say, okay, you said you did it. Show me your 7 certificates that said that you've participated in this online training. The training is housed with the Children's Trust Fund Alliance. It is very good. It's very interactive, and I would encourage anybody if you want more information, reach out to me, and we can certainly get that to you. We're also encourage our programs to really promote those protective factors in their life and work. We have a lot of people who are certified trainers now. It started with the Alabama Partnership for Children, and it branched out to all the family resource centers, and people are continuing to go through the 3-day training. All of our field staff have gone through the training. So we're very, very intensely part of the Strengthening Families Network. Next. There's a picture when we first got. I think I see Stephanie there. Anyway, it was like 4 years ago that we really developed this training. We brought the national trainers to Hoover. We had all these people in 3 days. We got a lot of folks trained. We had 3 before that, and that day we went from 3 to 33, and now we have over 40 folks that are certified in the Strengthening Families framework that can go out and actually work with families. And you see a lot of the folks there, not only some of our staff, but Family Resource Center staff. Next slide. That's a map of where some of the family resource centers are located, that they continue to grow. So I would encourage you to go to their website. We call them ANFRAC, which stands for Alabama Network of Family Resource Centers. So you can Google that, and they have an interactive map. But as they grow, that Family Resource Center approach to wraparound services and meeting families where they are, we know is a wonderful tool to have in our state. Next slide. And obviously, we didn't talk a whole lot today. There's not really enough time. I want to give ample time for questions, and also for Stephanie, which is really, she's going to get down in the weeds with what they do and in her program that's so valuable. But we didn't talk a whole lot about adverse childhood experiences, but we know that they're out there. And one of the things we want to do is really prevent those. Certainly, if you've been abused or neglected, that is an adverse childhood experience. And we know that if you've had more, there's a questionnaire that has 10 questions. If you have 3 or more, you're going to have problems down the road, not just with school and other life issues, but it could cause long-term health problems. We know that working with our school health professionals, they have said that they have seen a real uptick in asthma in the last 3 years. Well, what have we been dealing with in the last 2? Well, we've had an epidemic. We've had a COVID. And we know that that has put a lot of problems in families. It's caused economic problems. It's probably caused a lot of child abuse. I read an article the other day from the Centers for Disease Control and Prevention that the number of teenage suicides have vastly increased, and teenagers harming themselves, cutting themselves. So we know that if we can prevent these adverse childhood experiences early in life, we're going to have healthier kids, fewer cases of, as the slide says, obesity, heart disease, and depression. Next slide. And again, our whole idea, I always like to think of, you know, that we're focused on advocating for children, but you can't have healthy children without impacting their family and have a healthy family. And those families need healthy communities. So basically, you can start with the child, but it has to build outward so that all of our communities are safe and nurturing, and families, again, can be the kind of families they need for children to thrive and succeed in life. Next slide. It just says where to go to get some more resources. That's our website. And certainly you can reach out to me if you have questions. I haven't been reading the chat, Sarita. I don't know if we want to wait and do the questions at the end. I think might be best. And I think I did pretty well. I think we got plenty of time for Stephanie. So again, that's just an overarching kind of quick down and dirty look at our agency and what we're able to do as a standalone state agency to really impact and help protect and nurture children and families and communities in Alabama. Thanks, Sarita.
Thank you. Oh, let's see. Let me stop sharing. There we go. Perfect. All right. Thank you so much, Sallye. We are going to go ahead and turn it over to Stephanie. Again, Stephanie is the Director of Family Services at UCP Huntsville. Stephanie, are you ready to join us?
Yes, I'm ready.
Awesome. It is all yours.
Very good. Again, my name is Stephanie Wright. I'm the Director of Family Services at UCP. I have been with UCP for over 20 years now, and since my time at UCP, I have always been a grantee of Children's Trust Fund, and so it's been very exciting and encouraging to be able to provide services for families. And I didn't get to be in on the very first of Sally's talk. I was on another meeting, but I know she definitely stressed the importance of protective factors. And so I just had a meeting with my staff and just talking about how we're promoting protective factors basically with every service that we provide, and just commending them on the fact that they are in the community and helping to prevent child abuse and neglect. But I do have slides to share. Is that okay for me to go ahead and start that?
Yes, go ahead.
Let's see. Not sure if it's going to work out for us. Let's see. I'm not sure if that's going to work out or not. Can you hear me?
Sorry, I didn't realize I was talking muted. Yeah, so we saw initially your inbox, and then the slides opened up on top of it.
Let me try one more time. If not, then I'll just not do that.
So now we see your slides. They're on top of your inbox. Can you just like hit the box to make it larger? There we go.
Is that it?
It looks
Okay.
good.
I apologize for that,
No.
but again, I'm with UCP and I'll tell you a little bit about UCP. Basically, we serve children of all abilities, and our goal is to promote life without limits for all individuals with any limitation. And so we serve not just individuals with CP, we serve all children of all abilities. And here's my contact information. And so afterwards, if you need to get in touch with me, definitely reach out to me, because we provide services, some that are statewide, some are just local to this area, but a lot of our services are statewide. Okay. There's a QR code to a video about UCP, but of course we're a nonprofit organization. And like I said, we serve children of all abilities. Probably about 65% of our clients either have insurance or all kids. And so in the community, a lot of times it's hard to find a place where you can get PT, OT, and speech, a place that accepts Medicaid. And so we provide that service, and we also have grants and fundraising to be able to provide that service. Even if a client has high deductibles for insurance, we try to secure grants and funding to make sure that all individuals can receive the services that they need. And we don't just provide therapy, we provide comprehensive services. And so our two main hands-on services are building blocks and children's therapy services. And so in the state of Alabama, we have an early intervention program. And so any child in the state of Alabama, if a parent suspects a delay, can receive free services. And so you can have a free evaluation, and our team will go in and do the evaluations. And if there's a greater than 25% delay on 2 different tests, the child can receive free services. And so for early intervention, this is pretty much parent training. We have a team that goes into the home and they teach the parents how to promote development. And so that birth to 3 window is such an important stage, and talk about protective factors, teaching families what to expect and also how to promote that development. So our early intervention program that's available statewide, we just happen to have, we call our program building blocks. We just have that service here. And so if you know of a family, all families have access to this. So please help us spread the word. If a parent is concerned about a delay, just get that referral to early intervention. And the other hands-on program that we have is children's therapy services. And that's what you would think of as in clinic, your PT, OT, and speech. And so that program goes through age 18 at our facility. And so it's great that we have both programs, because some families may need early intervention and also outpatient services. And so we have that continuity of care. They can even keep the same therapist and come in, it might be something that's more clinical that the therapists need actually hands-on. And so they can go from early intervention to outpatient and have the same therapist. So our CTF funded programs are Hearts and Family Connections. And so talking about children and parenting is so tough. It's a 24-hour-a-day job. And I tell people that when I first started at UCP and with CTF programs, I didn't have children. And I always asked myself, how in the world could someone ever even think about harming a child? And then I guess with experience as a parent, just having a toddler, I guess it was the stage when I had a toddler and I had a newborn, and the toddler was crying, the newborn was crying. I've reached that point of frustration of just, what in the world am I doing and how am I going to handle this? But I also had the coping mechanisms. So I guess as a parent, just understanding that those frustrations are real without even adding on any extra special needs. The frustration of parenting is real, and it just really helped me understand that parents just need support. And so through the Hearts program, we're able to offer vouchers to allow parents to take a break. So through the Hearts program, they can hire a caregiver of their choice, someone they trust. That's the main thing, to be able to find someone that parents actually trust and to allow them to take a break. And so hopefully this will allow them to go on a date with a spouse, or to run errands, or to enjoy a hobby that you may not otherwise be able to enjoy. And so the Hearts program has just been a godsend of being able to offer families a break. And also, we also have family connections. And so we have a parent support group. And just recently, it was just really encouraging to see a veteran parent show up just at the right time to encourage parents and help them realize that it's okay to take a break. A lot of times, families that have so much going on with caregiving, they don't realize that it's okay to have fun. Not only can you use your respite money to run errands, that you can use it to actually have fun. And so it was just in this job, I get to experience such moments of just seeing what a benefit these services are providing. And also the family connections, we have several different components, but during the parent meetings, it's just a good time that parents can be honest and to talk about how hard it is and that it's okay. And then again, like I said, the veteran parent coming in and saying, you guys are going to make it and we're here for each other. And so that's the one component of family connections. I'll skip to some pictures. We also plan family events. And so we did the splash pad and we do field trips, and it's just a good way of reducing that social isolation, protective factor, and just connecting people with other parents with similar circumstances. And when we went to the splash pad we went to, it also had a fence all the way around the playground and the splash pad area. It's just that realizing there's places in the community that parents can go and, there's a fence and I can meet other parents and I can actually relax and allow my kids to have fun. Sometimes it's just being able to educate parents about what's available, and then the field trip of actually them going and realizing that they can do this, they can get out in the community. So another part of family connections is family fun times. And so we have parents, it's parent and child, and they come in and Kendall or another parent educator leads a group, like a mock group. And so they'll do craft time and they'll do story time. And so not only are parents meeting other parents, they're leaving with ideas of things that they can do at home. And so that program has been a huge success as well. And then of course you can see we also do activities at Christmas. Just all of these activities, the purpose is to connect families and just to offer them support. So in addition to all of that, we have so many programs at UCP. We do a preschool readiness group. And so especially with COVID, some of these young children haven't been around other children. And so we limit the class size and we bring children in to socialize. For some of them, especially this year, it's been the first time that they've ever been around children their age. One of our moms just really wanted to witness, how is my child going to react when he sees someone his size? Because of COVID, they had not really had that experience. And so this is not only good for the children, it's also good for the parent, because just realizing that their child is successful and can function in a group setting. So we have purposely planned activities and crafts, and so they're getting that developmental information and able to then be ready for school. So they're doing things like circle time and learning to follow instructions and just being prepared for being able to be in a regular preschool or school setting. And then, of course, I've talked about Hearts, but Alabama Respite is a statewide program. In our Hearts program, we do have all the UCPs in the state have a Hearts program. It was replicated to where all of the counties in the state have a Hearts program. But also Alabama Respite, it's a statewide program, and you from birth to lifespan, there's respite dollars available. At some point we will all be a caregiver, and so this Alabama Respite can provide support through lifespan. And also what's encouraging Alabama Respite has a caregiver wellness initiative. We had a situation with early intervention. Our staff realized a parent was overwhelmed. We were able to offer respite and also mental health counseling. And so these programs are really making a difference. And then also having the staff encouraging mom, man, it's really great to ask for help. It's a strength that you're, admitting you're overwhelmed and that it is okay to ask for help. It's tough. We need to support each other. And so just being able to have through our early intervention program and outpatient program staff out there just in the fields, working closely with families, building those relationships and letting them know that we're here for you. We have programs to assist you and it's okay to ask for help. So another one is Tourism Alabama. And so that's a fairly new program. And so with this program, we have someone going in and training hotels how to be sensory friendly. And so for any child with autism, we can offer a free trial stay. And so they can have a free night stay at one of these hotels that has been trained to be sensory friendly, just to encourage families to be able to, go on vacation and stay in a hotel without their child being so overwhelmed. And so that's a really exciting new program that we have going. And then we have child care enhancement with a purpose. And so we have a team that will go into daycares and just train teachers of how to better serve someone with a disability, how to better include individuals with a disability. And so the key is, to have all children be included. And so that just provides teachers with support to where they can better handle if there's a behavior issue or different things that might come up. We have a staff that will just go in and observe and then provide the training to support that teacher. And Help Me Grow Alabama, that's for birth to 8. And so that's for all families that can provide support and resources. Again, another program just to help promote that development. And all of these are on our website. So if I don't answer your questions about one specific program, you can go back and look at our website. But First 5 Alabama, we have an infant mental health consultant. And so in the daycares, if there's a child that is experiencing issues that's not due to developmental delay, it may be more because of trauma or something that's happened. It looks like it's more of an emotional type need. This consultant can go in to the daycares and try to identify what's going on with the child. And they can also go into the home and try to figure out, what's going on at home. And just really, we have all these supports with the goal of just supporting and helping all children and families just live life to the fullest without limitations. So we have a lot going on at UCP, and I have a wonderful team and staff. We have, experienced therapists, and we have so many people, Alabama Respite. Everyone is so wonderful and have such a heart just to help people. And like I said, all of our programs that they touch on or promote at least some protective factor along the way. And so I feel like, all the work that we do is helping to prevent child abuse and neglect, because definitely growing a better tomorrow for all children takes us working together for sure. Any questions?
Awesome. We actually do. Stephanie, if you want to stop sharing, I'll pull Sallye back to the screen too. Perfect. Let me get Sallye back. That was really, really good. All right. Okay. So the first thing I wanted to throw out, some folks are asking for the slides. And so they would love copies of the slides. So if you guys want to share those with, I have yours already, Sallye. So Stephanie, if you want to share yours, I'm happy to send those out to everyone who registered. So we're happy to do that. There was a question in the chat box that asked about Tourism Alabama, and they're talking about mobility needs. Establish a rapport with hotels so they feel open to calling UCP about other accessibility issues as well. So I'm not sure if Cheryl fully answered that question or not. Do you know, Stephanie, what about mobility needs with Tourism Alabama? And what does accessibility look like with that program?
So Tourism Alabama is specific to sensory needs, but anytime anyone wanted to call us to consult about, advice that we could give hotels, we do have PTs on staff that we could offer advice for sure. It's not a part of the Tourism Alabama, but we're always here as a resource for sure.
Okay. Let's see. So just a few other questions. The slides about Tourism Alabama. It looks like a lot of the programs that UCP Huntsville offers fall under that prevention umbrella. And it's really kind of how you wrapped up at the end, Stephanie, about having programs like these available for families. Those are prevention methods, like we want to be proactive, right? We want to get in front of issues. And so being able to give those breaks and those moments of stress relief, those are all ways that we're goaling to prevent child abuse and neglect. One of the questions, let me pull it up. One of the questions that we had was, and I think you answered this one, Stephanie, are prevention programs available to any family that's looking for services?
So our HEARTS program, it is specific to children with disabilities, but that can be any special need, a mild speech delay, just, but other programs are open to anyone, like First 5 Alabama. You do not have to have any type of disability to access that service.
And I would just add, Sarita, that again, those family resource centers that are located throughout the state, that's what they're there for. Again, to meet families where they are. And if they don't have that particular resource, they can connect them to that resource. So we want to grow those, and they are growing, thankfully.
So this one says, are the programs, and I think you answered this one too, but are the programs at UCP only for families with disabilities?
Well, we serve children of all abilities, especially through our Children's Therapy Services outpatient program. I mean, my daughter came for sports injury, so we can serve all different diagnoses and even individuals that just have a mild limitation that's temporary. So we do serve all individuals.
Perfect. Debbie put in the chat that her children, her daughter had early intervention with UCP. One of the things that they've noticed in terms of mobility issues in public places, sometimes the handicapped parking spots are pretty far away from the door, or they're at the curb and you can't you can't use, there's not a ramp for like wheelchairs. I think those are really, really good points, Debbie. I think my youngest child is in a wheelchair, and I have to agree with you that sometimes in public places, areas that are marked accessible aren't. And so, those are things that we just have to keep, trying to change and work through and raise awareness. If there's a particular organization or location that you're visiting, I would say speak to the people there to see if that's something that they can, try to fix. If it's a grocery store or an entrance of the school or whatever it may be, I think it's just worth a conversation sometimes. Let's see, this one says, what can I do if I suspect child abuse or neglect, and how would I report it?
Well, they could go to our website. I mean, we definitely link DHR's mandatory reporter training to our website. And we do a lot of webinars on that, especially with teachers and educators around the state. But if they suspect child abuse or neglect is occurring, they need to contact their local Department of Human Resources or law enforcement.
Yeah. Can I make an anonymous report of abuse? Yes. Yeah, you can. When it comes to parenting classes, are parenting classes only for families with children? Is there something available for expecting mothers?
Do you want to answer that, Stephanie?
Yes, any parent would be welcome to any of our parent meetings. We would definitely encourage them to attend that.
Mm-hmm. And I would say too, if you're looking for something, like if you are an expecting mom, I would say maybe have a conversation with your OB. They could probably connect you with some parenting courses or some resources. And it may be UCP. But I would start with my OB if I'm looking for a parenting course as a new parent and see what may be available. I will say when we started our journey of education awareness through the organization, through our LEAP program, we did reach out to an organization. We wanted to participate in a parenting course that they were offering because we wanted to see the framework design of the program, and we couldn't be a part of it. One of their questions were, do you have an open DHR case? And we said no. And they said, well, do you have a child in the system? And we said no. And we explained that we wanted to just kind of look at how they develop their program and how they reach their audience and the information that they provided. But just as a parent interested, we couldn't even get a seat in an upcoming class. It wasn't until we shared that it was for the purpose of developing a program that we were able to be a part of it. So I do think that, at some level, we have to create these opportunities proactively. So families who are seeking support before they need it have the same level of resource and support available. So I just wanted to share our experience with that. So, but I would say start with your OB if you are an expectant mom and see if they can navigate some resources for you. Let's see. When it comes to child abuse and neglect, do the signs and symptoms vary from state to state?
That's interesting. Well, I don't deal with it on a national perspective per se. I deal more with our Alabama specific state data. So there is a child maltreatment report that's released by the Children's Bureau every year, and they could certainly, list all the states, and you could kind of get a snapshot there. One of the things that we think may be happening again because of the pandemic, once the schools are now beginning to open and childcare centers and other facilities, I think you're going to see kind of an uptick in the number of reports. That doesn't mean that they're substantiated, but I think that from what we're hearing, and again, it's just kind of sad to say, but it makes sense because if parents couldn't get out, or if their jobs were impacted, food costs we know are going up right now. So there are a lot of things that impact families that kind of seem like they're out of our control. But if you're kind of aware of it and know that you can again get those wraparound services. But those economic conditions, lack of job, leads to stress. And as Stephanie said, and we both said as moms, you think you know a lot about raising a child, and then there you are. And all children are unique, and they all come with their own sets of challenges and personalities and everything. So again, I think I keep harping on family resource centers, but it's a great first step to connect. And if there's not one in your area per se, there are other grantees that we fund. Our website has an interactive map, so you can go to your county and see exactly what we're funding in that county and for how much. And I just wanted to I know Bailey Waller is on this, and she is not only our person that kind of leads the Parent Advisory Council in Alabama, she's also the program manager in charge of our community-based child abuse prevention grant. And our respite programs fall under that. And we've been, the national spotlight has been very much a part of what we do in Alabama. Not all states fund with their prevention dollars respite programs to the extent that we're doing in Alabama. So we've received some national acclaim to that, and I think that's something this audience might want to know too. So that's another feather in our cap, so to speak.
Yeah, and that's really good information, because again, the goal is prevention. And so, the entire objective is to share, or the objectives of today's conversation is to share resources that are available, so you don't find yourself feeling that overwhelmed. And so please feel free to reach out to Sallye and Stephanie or myself. There is a statement in the chat that says UCP Huntsville also has a tab on their website about early learning tools and resources, including topics about typical development as well as developmental concerns. One tab specifically, I scrolled too fast, hold on. One tab specifically features resources in Spanish. And I mean, that's really, really good to know, because it is important to have resources culturally appropriate. So everyone has access. And they did put, I think this is Cheryl, they did put a link. So if anybody wants to grab that link out of the chat box, there's another link in the chat box. I'm not sure what the link is, but it says that it's a resource that they wanted to share. I think this is from Asia, who's a part of UAH autism program. I think that's who put that in there. I'm just making sure I get all the stuff out of the chat, make sure I don't miss any questions. We have about 13 more minutes. So this one is talking about childcare enhancements with a purpose, benefits children in the classroom, not just the child with disability. This is Cheryl again, help me grow. So she's just really piggybacking all of the information that Stephanie provided. You guys can grab that information from the chat box. Thank you, Cheryl, for sharing that. So just as we start our wrap up and get to the close of our conversation, I do again want to thank you guys for joining us, but what would you kind of leave us with as far as a takeaway in terms of child abuse and neglect prevention? A word of encouragement, or how can families stay in front of prevention of child abuse and neglect, whether it's within their homes or within the community? What will you share? And I'll start with Sallye.
Well, I just like to say April may be Child Abuse Prevention Month as from a national perspective, but every day, every month is Child Abuse Prevention Month. And we certainly never want a child harmed in any way. I would just go back. I think, again, it starts with your community. If there are resources out there beyond just the funds that we have available to grant out, I will say that I'm real pleased that we got another big boost in the Education Trust Fund budget with our state legislature this year that was recently signed by Governor Ivey into law. So the more funds we have, the more resources we have to give out, the better, obviously. So that's one of the things that keeps us moving every day. It's just, there's just not enough. You're investing in our most precious resource, the future, and that's our children. So.
Thank you so much. Stephanie, what about you?
I just think that we can all make a difference, and just a reminder that we all need to take part in preventing child abuse and neglect. And it takes a community, it takes everyone working together, and just we all need to step up and support each other, and we can all make a difference.
Well said. Well said. Well, even with 11 minutes left, we are, I don't want to just keep hunting for something to talk about. Because they can just keep spiraling and then we'll run out of time. So again, we want to thank Sallye and Stephanie for being here with us today. If you want to connect further with Sallye and Stephanie, the Children's Trust Fund, UCP Huntsville, we do have live links to both of those organizations on our website, and you can access them from there. We figured that would be super, super easy to do that for today's talk. We actually have them listed on our website as resources. We wanted to make sure the families within our patient demographic community understood what services were out there. So you can find access to them on our website. Again, this webinar has been recorded. You can find the recording on our YouTube channel. You can also find an audio version on our podcast, the Being Rare podcast. And so for those who like to listen versus watch, that is also available. As always, if we could ever be of assistance to you or your community, please don't hesitate to reach out to us. We are here for that purpose. And so if you guys don't have any last words, we will give everybody 9 minutes of their day back. Thank you again so much for being here.
Thanks, Sarita, for the opportunity. Thank you.
Awesome. All right, everybody have a good afternoon. Thank you so much.
Yeah.
Thanks. Bye-bye, everyone.